Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health. Hello. Good evening to all. Good evening to all. Welcome to Telehealth Tuesday. This is your go-to podcast on modern healthcare and wellness solutions. I'm your host, Dr. Michael Bookhardt. Today we have a very special episode for you. Now look, before I tell you about what we're going to do for this episode, I want to give a shout out to our sponsors as we do each and every week. Number one, we have Graphics R. Chase Design. We also have P5 Solutions, and as always, a dime, a dynasty. I want to let you guys know that Telehealth Tuesday can be found on all platforms or multiple platforms, including our YouTube channel, which is Dr. B TV. Now that's the word doctor spelled out, DOCTOR, and the letter B as in boy, TV. And if you just put that in Google or you go straight to YouTube, it'll take you straight to our channel. And please make sure to like, click, and make sure to click subscribe. That's most important. We appreciate everything that you all do and for joining us, but please make sure that you click subscribe. That's very, very important. And this will help us to support not only this program, but also other things that we're doing in the community. Now, I was getting ready to read to you the profile and the bio of our guest, who is going to be Dr. Sharmon Robinson. But unfortunately, Dr. Robinson has fallen ill. She is not feeling well at all. I've spoken to her. She is at least stable, but she is in she's not doing well in terms of that. So we hope her a speedy recovery. We know she's going to be okay. We hope that our thoughts and prayers go out to her. But again, she fell pretty ill, and so she's not able to be with us. She was very upset about that. She wanted to be there so badly, and she was, sharing everything. We were telling all of her colleagues and friends and family members about tonight, where she was going to educate us on physical therapy, what that is, with chronic low back pain, and all the different exercises they do. But the good news is that we will definitely have her on very soon. I've spoken to her, and again, she's in great spirits. She is looking forward to making up the episode with us coming on. Possibly, hopefully later before the end of this year, and then we'll just kind of go from there. But hey, so we're going to get right on to it. What we've chosen to do, by the way, we want to give a special shout out to Mr. Kenoy Brown. I know all of you all that are around in the area know this gentleman. He's an extremely funny guy. He's hosting all over the place. He's featured everywhere. Very popular Jackson socialite and a friend of mine. And so he has his Tuesday, Hot Topics Tuesday, that he's asked yours truly to be featured on. And so we're going to go right into that following this episode at 8 p.m. We're going to join Mr. Kenoy Brown. And you never know what that guy is going to say. So stay tuned for that. All right. So what we've chosen to do, folks, and we've talked to the producer about this, what we're going to do is go into a set of questions and things that are plaguing our community and that are certainly of interest to many of you. And those are basically the hot topics, in medicine. Those would include things such as, what are the current vaccine recommendations for at-risk populations? What about, what do we do to keep kids healthy in schools? What about the role of telemedicine in managing chronic conditions such as hypertension, diabetes, and obesity? And also, recognizing different complications in respiratory illnesses such as COVID and, influenza, all those kind of things. So I know that these are things that we, especially in the primary care field, we talk about all the time. But nevertheless, there are things that we still don't talk about enough. And so without further ado, I want to get right to it. We appreciate I see some comments here. We've got Alexis, my dear patient. And again, we're going to be with Alexis. We appreciate you joining. She's Alexis Bailey. Now, I always want to say Alexis Granger, but We've had a fascinating story again. Shout out to WAPT News for coming to our clinic, to Good Faith Wellness, to shoot this special. It's about a minute, about 90 seconds. If you go to WAPT News and Google my name, Dr. Michael Bookhardt, and you can put, I think you probably can put Alexis Bailey, you can put COVID survivor in. You'll be able to see that on WAPT. You'll also be able to go to Dr. B TV on YouTube, and we have it right there. It's categorized right there, talking about COVID survivor, and that's featuring Mrs. Alexis Bailey and her amazing story, basically how she has transitioned from life support back to life. And so there are some amazing things coming forward. We're going to have her on the show later this year, and we'll go from there. So, one thing, oh, by the way, and we are live, as we always say, each and every week, every Tuesday at 7 p.m. With God's grace, we are here live, and you can submit your questions. I can see them coming in as we speak. We can see people joining, and we are broadcasting on 2 platforms on Facebook, Good Faith Wellness on Facebook, also Dr. Mike Bookhardt on Facebook, the Dr. BTV on YouTube, and also Dr. Michael Bookhardt on LinkedIn. So we are on all of those platforms simultaneously. So again, without further ado, please don't all ask your questions at once. No question is a silly question. No question is stupid, as they say. Every question will be answered to the best of our ability. And so I can see it right on the left side of my screen. So any question you guys want to ask about the vaccines, you want to ask about obesity, you want to ask about weight loss surgery. By the way, we're going to have Dr. North on here. Very exciting. Some of you might have seen my former previous guest, Miss Melanie Sanders, former Miss Atlanta. At some point, she's going to be joining us again. And also, she put something out that was called the Tit Talk. It was about some of her personal experiences with having reduction surgery. And this was by Dr. North, who is here in Flowood. Had a great conversation with him. He will be featured. I believe it's December. Let me look at that. I believe it's December 11th. December 10th, along with Miss Jasmine Briscoe, who's a certified lymphatic massage therapist. And she also is a specialist in body sculpting. So you definitely don't want to miss that. But we'll also feature Dr. North. And you definitely don't want to miss that, Dr. William North. He's a plastic surgeon, and he is making remarkable strides in our community. All right, one thing. Someone wanted to know about the current vaccine recommendations for at-risk populations. Okay, this is the thing. And I know that there are so many people, especially that they have their, good evening, people that have their feelings on vaccines, whether it's, the children, or whether it's even personal for adults that may have their concerns or questions about it. The thing is, though, if we're going to just stay objective on that and talk about what are the guideline-based recommendations objectively, what does the CDC recommend? And so obviously we talk about the annual, flu vaccine. We talk about at-risk population. Well, who is at risk? So one person would be, you can say diabetics, right? A person who has diabetes mellitus, or that's affectionately referred to as the sugar in the South. This is an at-risk population, because at-risk meaning that these are people that are more prone to different diseases because they're in a way immune compromised, right? And so when we think about being compromised, a lot of times people only think about those with HIV or full-blown AIDS. Those are certainly at the top of the list. But we must remember that we are also talking about those with chronic kidney disease, not even necessarily dialysis, but especially dialysis, but chronic kidney disease, those with diabetes, those that have HIV, full-blown AIDS, and then there are also those that have cancer and that are on chemotherapy. And that's just a few. There's a whole list of people that are in the immunocompromised category. People that have had certain liver diseases, hepatitis, for example, hepatitis B as in boy, hepatitis C. So those are the people. And so the recommendations for at-risk populations, little bit differently, but still for those that do take the flu vaccine, senior citizens that take the the pneumovax, Prevnar, different things like that. The recommendations are similar, but again, with those that are immune compromised, then you start talking about things like COVID vaccine and things like that. Now, we know that a lot of people have their views and their feelings about COVID, and for many good reasons. And again, we're not here for any of that. We're going to remain objective and just tell you what the actual recommendations are. And what I've told a lot of people is that they say, Dr. Bookhardt, do you think that COVID is going to be like the flu? And the answer, in terms of, is this going to be something we're just dealing with? And I said, absolutely. My feeling is that this is going to be something that unfortunately we're just going to be plagued with, annually. It's something that's not going away. Now, the thing is, people say, well, and even some of us healthcare experts and in the field of medicine get a little bit, beside ourselves. We say, well, you remember back in 2020 when COVID was going on. The thing is, folks, COVID is still going on. Okay. COVID is not going anywhere. The only difference is that COVID, we have learned how to better, lessen that. We got the vaccine, the recommendation from CDC, all the experts. Now we know what we're dealing with, and so we're able to hopefully better prevent things. We're able to educate ourselves. We're able to educate our family members, educate our patients, and so. But believe me, okay, I would say put all the cameras on, but there's one camera. Okay, so I'm looking in the camera. COVID is still here, okay? So it is not going anywhere. So we still need to do the same things. Hand washing, utilizing sanitizer. I know most people don't do the 6-foot distancing, and in Kroger and Walmart and Target probably would be a little bit weird, and you'd probably get skipped in the line if you're standing in a line. But as much as you can, you really just don't want to be right up on people. You don't know what they have. You don't know who's vaccinated, who's unvaccinated. You don't know who has a fever. You don't know who's been feeling sick and just won't let you know. So we have all of those types of things going on. So you always want to use, as we say in the medical field, universal precautions. And that means the same things that we were doing before, we need to keep on doing. So that is, again, using sanitizer, washing your hands, even wearing gloves, especially those that are in the medical field and dealing with patients and high-risk patients and folks that are coughing and having a lot of sputum production and fevers, using that, putting on a gown when in the hospital when people are on contact precautions, when they have certain types of diarrhea and other things. And so this stuff is real. And flu is not the only respiratory virus that can get you sick or kill you. Okay, COVID is still out there, and it is real. Let's go to some of these comments. All right, Dr. Robinson, look at Dr. Robinson. Look here. This is true dedication. Dr. Sharmon Robinson, we appreciate you coming on. I just let everybody know that you were feeling ill, that you could not be on the show, but it means so much to see you on here. And she is giving her apologies to the audience for being ill, but she said, I'm hanging in there. She wanted to ask, can you still get influenza if you've had the flu vaccine? And man, that is a perfect question. And the answer is, oh wait, I got some things on here. Wait, here we go. I know my producer's watching. So the question is, can you still get the flu, if you've had the vaccine? Here we go. I really like that. I know that's very cheesy, but yeah, that was awesome. I hope y'all could hear that. But anyway, yes, the answer is yes. It's the same thing, just like COVID. The thing is, they develop these vaccines, right? And their particular strand, especially the flu, is a particular strand, right, of the virus. That's why a lot of times it's kind of a year behind, because it's tailored to, basically providing antibodies against that particular one they've isolated, right? But then there are other mutated type, viruses, different strains, and all those kind of things that come along, and that's why people still get sick. But the thing is, what the point of being vaccinated against influenza, COVID, and all the other things that are out there in vaccine, what we're hoping to do in the medical community is provide you with enough immunity, right? And enough antibodies that are circulating around to make it so that you, if you do get infected and test positive for these illnesses, that it's not something that's going to kill you. Okay. So yes, the answer is, Dr. Robinson, yes, these folks can still get the flu, but and I want to be clear. A lot of people say, well, heck, if I'm going to get these illnesses, the flu, if I'm going to still get COVID, well, why the heck should I get the vaccine? Yes, you should. If you are in agreement with getting the vaccine, there are people who have religious views or their own objections, right? But if you're in the average population who is okay with and accepting of the vaccine, then by all means you should still get it, because the numbers don't lie. That there were far fewer deaths, and none of us can argue with that objectively when people were vaccinated, and that is simply a fact. Uh, all right. Good evening. Good evening. Let's see. Let's go. We appreciate the comments. Keep them coming, folks. Keep them coming. Let's see here. We have good evening. Concur. All right. All right. Thank you. Well, y'all keep on coming in. Come on in. And please, again, don't ask all your questions at once. We are live. We are here for you and your questions. There's no question too big, no question too small. We love questions. And here's a little shade. We're not going to shy away from reporters and questions. I'll leave that one alone, okay? But we're never going to shy away from the public, from questions, because we believe that folks that are here, that are medical experts and leaders, and that should extend to other fields as well. Again, we won't go there, but we should be held to a certain standard. And since we are public servants in a way, we are responsible for that. And so we need to answer these questions because there are a lot of people out there that simply don't get access to care. It's unfortunately why Mississippi is always at the top of the bad stuff, and that's because a lot of people don't have access to care, and which we know in this civilized nation that healthcare should not be a privilege, right? This should be a right to all American registered citizens. So anyway, we are here for you. There's no fee for that. You can ask your questions. You can book an appointment. You can do all of that. GoodFaithWellnessCenter.com has open appointments. We'll be glad to see you. We've got different packages, $99 a month for unlimited visits for individuals. And then we also have packages for couples and families. So GoodFaithWellnessCenter.com, you'll see more information about that. Let's see here. We have one. Okay. All right, we've got some on LinkedIn. Okay, we're just saying hello there. Donna Owens, remind people, age 50 plus about the shingles vaccination and hepatitis A and B. Thank you very much. Well, absolutely. And so I appreciate that, Donna. Those are certainly, things we need. So, again, objectively, age 50 plus shingles. So basically, that's with zoster. So shingles, when you've had the chicken pox, right? And then when you get older, people talk about shingles. It's a viral disease. It goes across a dermatome, which is a nerve pattern. So that's why you see people getting, back here, along the back, and even sometimes on the chest, very painful areas are kind of red and excoriated areas that are just so painful to the touch. It's even when they move, when their clothes, rubs against it, people are yelling out, screaming bloody murder. So that is what, shingles does to, unfortunately, a lot of patients. This is something that rears its ugly head later in life. And so you get the Zostavac, the shingles vaccination, to hopefully prevent that, or at least mitigate, the symptoms. So absolutely great point, Donna Owens, that we must be vaccinated. We need the shingles vaccine, hepatitis A, which is foodborne illness, kind of stuff like people eating certain contaminated foods and things like that. Hepatitis can be transmitted. That's why, you talk about E. coli with, undercooked beef and all that kind of stuff. You talk about different things with, chicken and all this kind of stuff. You have to be so careful. And that's why undercooked food, the CDC recommends against that. And you'll see at all the popular restaurants that they say, hey, undercooked beef may lead to this and that. And so they want to make sure to prevent things, like E. coli infections and spread like that, and also other, viral illnesses. So absolutely, those vaccines are necessary. Keep them coming. Great question. We'll move on to some other things here, but y'all if you got more questions about vaccines or anything else, nothing is off topic tonight. We are exploring all topics. And again, thank you so much, Dr. Robinson, for joining us. We know that you're ill. Our thoughts and prayers go out to you, and we're wishing you a very speedy recovery. Now, let's talk about this differentiating the common respiratory illnesses. How do you basically know the difference? Well, the obvious answer is, of course, you come in a clinic and you get swabbed, it's going to test positive. You got COVID, you got, the flu. Now, if you have pneumonia, what about that? That's usually a common when people ask, and is that something that can be, spread? And so the thing is, say if you have, flu, it's easily, tested. And if you have it, so you can take Tamiflu as treatment for 5 days, or you can do 10 days or, prevent, like say if you've been around somebody with flu and you're not having symptoms yet, or maybe you just have a slight cough or just feeling a little weak, and you either don't have access to getting the flu shot or you just frankly don't want to go, then you can also take Tamiflu, which is the 10-day, once-a-day method, which is the prophylactic or the preventative thing when you've had an exposure to somebody with flu. But also differentiating, in COVID with these different types, and everybody to get on the news, and you hear all this kind of fear mongering. They say, oh my goodness, this year it's going to be worse than ever. People are coughing up blood. A piece of lung tissue has been coughed up in New Zealand. You hear all kind of stuff from people. So I would just say you have to take everything with a grain of salt. But usually the symptoms with COVID are, I would say a little bit more vague, because again, the question of the topic was, how do you kind of differentiate? There can be similar, there can be some crossover, some things that overlap. But with COVID, one of the hallmark things was that people would have these headaches, that you didn't always get with, the flu. Both of them can cause coughing. Both of them can cause extreme fatigue. Both of them can cause rhinorrhea, drippage and things like that from the nose, from nasal cavity. And people can mistake that as, oh my goodness, I just have like a sinus infection, or maybe it's just allergies. And that's why it's so difficult to, kind of tease that out. But the thing is, if you start developing fever, if you know that you've been around sick people, a lot of sick kids at the daycare, like either you work at the daycare or you have several children there. And obviously the children, if they live in the house with you, they've been exposed, which means you've been exposed. And so those are the things. And if your symptoms are getting so bad and not getting any better over a few days, then that's something that hopefully should, propel you to say, hey, let me just at least go and get tested, Now, there are some other people that the devil's advocate, they might say, well, what about the false positives, false negatives? And that's why then I come back to that and say, well, one of the first things we learned in residency training as doctors say, look, do you treat the patient or the numbers, right? And so you might say, well, I was negative for flu, I was negative for COVID, but that still doesn't mean you don't have flu or you do not have COVID, right? So if somebody is still appearing sick or appearing ill in the medical field, if we're doing our job and our due diligence, we should still, encourage you to isolate. We should still encourage you to maybe get retested. And then also, if it's a really high likelihood that you have these things, we should encourage you to get treated, again, that's the beauty and then the curse of medicine. There are very few things that are just straightforward. So what is best if you cannot get flu shots or COVID vaccine? Well, it's a great question. The thing is, there are a lot of people out there that either, by choice, they don't want it. They also have certain allergies and egg allergies and different things like that. So there are people out there that are, not able to objectively get vaccines that would otherwise want them. And so the answer to that would be, if you're in that subset of that category of patients that is not able to, or just does not desire to have these vaccines, then, what I would say is that you should take the same universal precautions that we do, but probably even more so Instead of going to I know for all the football fans out there and sports fans, but instead of going to a heavy populated game, a heavy populated tailgate, a heavy populated concert, or even if people that go to mega churches and things like that, it would probably be best, and especially if you're in an at-risk category, and we define that at the beginning of the show where we talked about at-risk, those with chronic kidney disease, those with diabetes, HIV, cancer, who are on chemotherapy and things like that. Those type of people should definitely do their best to avoid those situations, right? Avoid exposure. If you've got family members who know that they have been sick, then you need to avoid that family gathering or picnic or that family reunion. You need to see those folks on Zoom. So that's what I would say to that. It's the usual same precautions, but like I said, but definitely if you know that you either are unwilling to be vaccinated for, that is your choice and we should respect that, or you just simply cannot have these vaccines for whatever reason, then you would be doing yourself a disservice if you did not simply avoid those things like that. That's, preventing. And we are in the field in family medicine of preventing illness. So great questions, guys. Natural ways to strengthen immunity is another topic that we want to go into. Some of the natural ways that we can strengthen your immunity, right? Some of the obvious ones, vitamin C. And so we're getting a couple of things here coming in, a couple of questions that people are sending me directly. Okay, perfect. We'll get to those. So, preventing and boosting immunity. So, and a lot of us, it's kind of like a do as I say, not as I do. One of the biggest things that Americans don't get, that we don't do well in this country, they do a lot of things well in this country. One of the things we don't do well is get enough sleep. And man, and I know it's easy to say these things. I mean, it's so much harder to get it done, especially when people who are business owners, people who are professionals, you're working for demanding companies, you're working long hours, and then those that are just simply because of their personal situation and even monetary situation that may have to just work a little harder, work longer hours or multiple jobs. Those people just unfortunately their situation are unable to get the required amount of rest, 6 to 8 hours of rest a night. And so that's one of the things, your body can really break down in its immunity without having proper rest. And that can lead to worsening hypertension. Oh, and by the way, one of the things with not having enough rest, one of the biggest causes is untreated sleep apnea. So if you've got that person out there that's snoring, usually we see it in morbidly obese people, but not always. Sometimes little slim, skinny people, they have sleep apnea as well. But especially here in the South and in Mississippi, we do see that in those that are, on the obese side. They're snoring all the time. They kind of fall asleep easily, sometimes right in front of you, and they definitely snore. That's one of the biggest risk factors. So having untreated, undiagnosed obstructive sleep apnea, or what we call OSA, that in turn leads to daytime fatigue, what we call in the medical field daytime somnolence. And so people are often falling asleep at work at the computer, falling asleep at the wheel. And they're a lot of times like, man, what's going on? The person was never sick. Well, you didn't know that they were never sick. Maybe they were just somebody who didn't have access to care again, or they never went to the doctor. Maybe they were irresponsible and they never went to the doctor, or just somebody who did go and maybe the provider wasn't able to pick up on these symptoms. But that's one of the things that we ask our patients at Good Faith Wellness Center. We ask, hey, do you snore in your sleep when people come in with daytime fatigue, headaches, blood pressure that you just can't seem to get lowered? You just can't seem to get it under control. And you question the patient over and over and over. Are you taking your medicines? Are you sure? Did you take them today? And a lot of times the sleep apnea is the cause of it. So that's one big thing that can help our immunity. And also another thing is, please, this should be a public service announcement. When you come to the doctor's office, and I didn't hear people saying this stuff till I got to Mississippi almost 12 years ago, I don't know why people say, well, I didn't take my medicine today because I was coming to the doctor. No, that is absolutely not what to do. That is the wrong thought process. If you don't take your blood pressure medicine or whatever medicine that you're on that he or she has been kind of titrating and working with you on to better control your, I'm mainly talking about blood pressure, your hypertension. So if you don't take it, right, you have just literally wasted a trip and a copay to the doctor's office, because we won't be able to do anything for you but collect your copay at the checkout. Okay. So if you don't take your medicine, all we're going to do is look at you and thank you for coming. All right. Please take your medicine, because that is the entire purpose of coming to the doctor's office. You're taking your medicine. When you come, I say follow up in 2 weeks. I see you in 2 weeks. All right. Your blood pressure is still exactly the same, still elevated. I say, man, did you take it this morning? Oh, I don't ever take it when I go to the doctor's office. I mean, I don't get that. But look, please spread this. This is a public service announcement from me to you. Please tell all your friends, family members, they need to do this, or they might as well reschedule. Okay, if they're not going to do it. I'm just being honest with you. The other things, all right, we're talking about boosting immunity. Vitamin C, echinacea, vitamin D. A lot of times African Americans, not just African Americans, but a lot of us, the vitamin D is low. Had a patient today, vitamin D was low. And so there's ways you can, if you can't get the 50,000 units, which is the prescription strength that we prescribe, you can certainly go over the counter and get 4,000 units, or maybe it may come up to 8,000. I don't know, but whatever the highest amount is, that's what you take. Okay, and you can double it, because if you're low, you can't get enough of that vitamin D, as in dog, helps us to absorb calcium, and that's involved in all kind of other things, osteoporosis, all this stuff, your bone mineral, your bone density, your bone health, the calcium, because if you don't have calcium, your bone, is demineralized, at risk for osteoporosis, and especially women at older ages. But if you don't have the vitamin D, so you can't absorb the calcium, you still go down that terrible pathway. So that's one of the things there. All right. Another thing was, what about the role of telemedicine? By the way, folks, okay, do we have any other questions? I'm looking at, keep them coming now. Keep them coming. Wait a minute. Oh, wait. I'm just learning how to do this. Oh, I didn't even know you could do that. Look at this, folks. I didn't even know that. Well, we're learning something. Wow. Well, this is perfect. So now, if you want to put your question on and you want to make sure that everybody knows, I will be able to highlight it. I had no idea. So that's wonderful. Let's see. All right. So keep them coming, please. These have been some great questions. All right. One of the things was, what is the role of telemedicine? The role of telemedicine, its role in managing chronic conditions and respiratory illnesses. And so, again, it's just like what we've been saying. The role of telemedicine, this is, if you will, a version of telemedicine, because when you guys come on and ask these wonderful questions, we are actually answering them with professional healthcare advice. And so this is, in a way, indirect telemedicine. We're not making any diagnosis, we're not charging anyone, but this is, in a way, a form, of telemedicine. And so the role of telemedicine, is endless. It's limitless. There are so many things that we can do. And they've been doing this for 10, 12, maybe more years, where they can do surgery. A physician, an expert, can be in China or North Korea, Europe, wherever, and they can be either advising the surgeon that has the patient on the table under anesthesia. They can either be advising him or her, or they can be with the robot and the utilization of technology operating on the patient that is on an entirely different continent. And so the role of telemedicine and AI and all that stuff is tremendous. Telemedicine role in managing these chronic conditions, such as, say, people that can't get to the doctor, right? Some people that are in the corners of the state of Mississippi, or maybe in the Delta somewhere, or don't have transportation, or just some faraway place. But if they might have a grandchild or a niece or nephew or somebody that can help them get on. We have a patient actually, good friend of mine. I don't know if he's on here tonight, but he's on our the fellows group chat, and he has a family member who is on the coast of Mississippi, and unfortunately has multiple sclerosis. And if y'all don't know what that is, very sad condition. Is a condition of weakness that is just a degenerative condition until people that sometimes they can't even get off the floor. Just a very sad condition, mainly affecting females in their 40s plus. And so his aunt has this terrible condition, and it's been plaguing her for some years. And so at this point, she's just not able to make a trip here, not able to travel, spends a lot of time bedridden or on the floor. Just very, very sad. And every one of my visits to this young lady have been, or with her, have been via telemedicine. So telemedicine absolutely has a role. Another one is, what about recognizing the complications? Are there complications from respiratory illnesses in high-risk groups? And, certainly the obvious answer to that is yes, absolutely yes. So again, that's why, and not just high risk, but everybody, in primary care, we want to make sure that we are preventing this, because also in my work as a hospitalist, right, every other week, that's the hospitalist is that random doctor that once you get admitted to the hospital, he or she is going to be making rounds on you, get you admitted, put in your orders. If you need surgery, we're going to get the surgeon consulted and on board. If you need a heart cath, maybe you're having a heart attack, a stroke, we get the neurologist to see you. And we kind of quarterback all that. And then when it's time to be discharged, we get you discharged. We are part of the process of making sure that you get your follow-up appointments, make sure that you get the appropriate medications prescribed to you. And so, those are just, so I kind of work on both sides in the preventative aspect at Good Faith Wellness Center and family medicine. But also, once you unfortunately develop these things or get sick, then our practice, we also treat you in the hospital too. But the main thing with preventive care, primary medicine, is primary prevention. We want you all to stay out of the hospital, right? We want you to stay out of the hospital. And interestingly enough, there are even insurance companies that incentivize the doctor and the patient too to stay out of the hospital, because if you think about it from a business perspective, if I'm an insurance company and I've got a bunch of sick, people. So, and again, without being political, but this was the entire premise of the Affordable Care Act, because the aim of that was to make sure that people that had pre-existing conditions and things like that, which are the ones that are most costly to the healthcare system, these people would not be dropped, okay, because of those conditions. And also people being able to stay on their parents' insurance till they're 26 years old. All those things, those were the aims of the Affordable Care Act, because these were the people that were the at-risk folks that didn't have access to care, that didn't have insurance, all that. And it was costing millions, billions of dollars to the insurance companies and to the government. And so anyway, that's all I'm going to say about that, because we're not a political show. We're not politically affiliated. But that was the purpose of that. So primary care, it is in everybody's best interest, maybe not the hospital, I guess, because without any sick people there, then, hospital can't make any money. But it is for the most part, 90% of us, it is in our interest that you do well, because when you do well, we do well. The country does well. And even certain insurance companies and how they have it set up with the doctor's office, he or she will even get a check, okay, from certain places after 3 to 6 months, when you show that you've kept the majority of your patient out of the hospital by providing excellent care, making sure they have excellent follow-up, making sure the patient is compliant. And that's why one of the particular physicians here, who I will certainly make sure they remain nameless, but he is a specialist here, and everybody knows when they go to this particular person, they go in there getting diabetes checked and taken care of. I know, and everybody knows this guy's name. If you don't do what you're supposed to do, and that A1C doesn't come down, you're literally getting kicked out of his practice. And that's the honest truth. And like I said, there are many reasons for that. And so this is really just giving y'all some insight on how healthcare works. Let's see. Will scoliosis develop over time if untreated? And what symptoms should the patient look for? Let's see. That's an excellent question. Let's see. That's from my high school classmate from Orlando, Florida. Shout out to Dr. Phillips High School. If anybody is there, shout out to Dr. Phillips High School. Um, Excellent question. So scoliosis developing over time. You know, it's one of those things where, so the answer is yes. Scoliosis, if you all don't know, is you kind of get that S curvature along the spine. And it's not really until some people, and the majority of the population does not get that bad where it's a noticeable kind of bend that you're seeing grossly when you see them walking. But a lot of times, like in the doctor's office, say when we walk around, we get a stethoscope and we listen to your lungs, right? And we're looking at your posture. If you're sitting up on the exam table and one shoulder is kind of doing like that, or you're kind of doing that, and it can be very subtle. And that's when sometimes we'll ask you to put your arms out at your waist and even bend over. And because we want to look at your back and see if one side up or not, that's what the doctor's doing, looking for those things. It's very important. Going back to your question, it's very important to recognize that, especially from a pediatric standpoint. The pediatricians, when they're examining kids, that's why they do the Barlow and the Ortolani examination, looking at their hips and knees, and they put the infant on the back, and you think they're just kind of playing with their legs, but they're examining, making sure there's no click in their where the thigh bone attaches to the pelvis and all that. You're actually making sure that the child is normal. And so you look at it, you turn them over, and you kind of look at how their back, the normal curvature, because the back is supposed to go in the lumbar area, right? It kind of goes like this and kind of goes in. But scoliosis is that it's on the sides of it. It's leaning. And so that scoliosis certainly can worsen over time. Again, going back to the mineralization of bone and how all of that develops. If you've been taking care of yourself, taking your supplements, if your calcium, your vitamin D, that plays somewhat of a role in it. Family history, how much weight you have on you. And again, I tell all the people, it's very simple. You don't have to have a PhD in physics to understand. If you got more weight on you, okay, if you're super morbidly obese, right, then you're certainly going to be more at risk for having back pain, probably worsening scoliosis, your knee joint, because our bodies are built to take a certain amount of weight. And so, unfortunately, in the South, people talk about, and I think I talked about this several episodes ago, there is this crazy thought process, or this misnomer or whatever, that there is a thing called big bonedness, okay? Let's go ahead and get all the rumors out the way again. So we're talking about bone mineralization with scoliosis, all this stuff. Folks, again, we had public service announcement, taking your blood pressure medicine before you go to the doctor. We had that one. Okay. A second PSA. Look, there's no such thing as big bonedness. Let's get that crap out of there, okay? Your bones are the same size. Your bones, once you're fully developed, okay, your bone is whatever size it is. It is meant to hold a certain amount of weight, that the spine. If you put an extra 50 or 100 pounds on that same spine, common sense, which is not common, will tell us that it's going to be more torque and more force on the spine. Therefore, you're most likely going to have back pain that you can't get rid of. And so it doesn't matter. And I tell even my own mother this. It doesn't matter how much hydrocodone you take, how much electrical stuff you go through. And as much as we do certainly agree with and all the time, we are pushing physical therapy, occupational therapy, chiropractic care. One of my partners is a chiropractor. Those things help, but they don't help as much when you as the patient, we as the patients, don't do our job, our due diligence. Faith without works is dead. So if you are labeled as overweight, but I'm mainly talking about obese, super morbidly obese. That's, certain BMIs, 35 greater, stuff like that, a body mass index. So if you're in that category, and like, again, there's no such thing as big bones, right? So you got the normal size bones, but you are just big, okay? Then that's going to be a lot more weight on the spine, on the knees, all that kind of stuff. And so that's why, you see people with bone on bone, as they say, osteoarthritis. You look at an X-ray, you see, and you see this kind of like this, the joint, and it's just grinding on joint. What you're supposed to have is fluid goes in between there, and the meniscus, right? The menisci, that's the plural form. But you have meniscus, like your medial meniscus, lateral, both sides, and these pads able to absorb the shock when you walk, right? That's how the knee joint flexes, right? But imagine if I have no cartilage, no pad, no insulation, no cushion in between those bones and my leg and my thigh bone. When I'm walking, it's a grinding. And that is what causes this chronic knee pain. And the same thing with the chronic back pain. And with people with scoliosis, with that curvature in their spine to the left or right, they hurt even more. And so that symptom developing over the time, going back to her question, that can be something, especially not corrected. There's certain braces and certain things that you can do in certain postures to help that, and the braces to help prevent that. But once let's say that nobody saw that in childhood, or maybe you didn't even develop certain things until later from terrible posture, it's probably a little too late for, bracing and all that. But you can certainly, work on your posture if you're aware of it. So yeah, certainly can get worse over time. And you said, what symptoms should the patient look for? Well, just those things. Chronic back pain, when you come into the office, say if you're a candidate for an X-ray, which we have full X-ray capability in the office, then hey, we do an X-ray. You can see scoliosis right there. We're looking right at your spine. We can get a lot of information from thoracic and lumbar X-rays. We can see how where your scapula, your shoulders are, how do they look rotated. From the back X-ray, we can look at your spine, how it comes down. We can even look at the joints and make sure is there enough space in between where each vertebrae kind of, articulates with the other. And it should not be right on top. It's supposed to be a disc, then a bone, a disc, then a bone. That's how that goes. And so chronic back pain with a lot of people, again, one of the reversible causes is extreme obesity. Getting some of that weight off, you're naturally going to feel better. I think that just makes sense. But also there's injections and other things that can help. So I hope that answers your question. We've got here, Jasmine, Dr. B from they're calling in from Clinton, Mississippi. That is Miss Jasmine Briscoe, who will be featured on that day on December 10th. Man, this young lady is amazing. Let me tell you. I just want to put in a plug for Jasmine Briscoe here. She does all these different therapies, and please tell me if I'm saying this wrong, if I'm pronouncing anything wrong, or because this is certainly not my area, but she's got all these gadgets, and you may think it's some torture equipment, but it's not. And it's this wood, like she does this wood therapy, I think it's called, different things that different from just the everyday massage therapist. She is a licensed massage therapist, but she's also certified in lymphatic drainage and all these different techniques. And she does some body sculpting and all the things that all y'all are interested in, the non-invasive ways to get that BBL look. And again, we're going to couple this with Dr. William North, board certified plastic surgeon who's operated on so many people here. He is excited about joining us on 12/10 on December 10th. As she says, wood therapy and manual cupping. That's it. Where she's got these cups, literally putting them on you. And, however that the suction, and I don't even understand. But all I can tell you is I've tried it. My mother and I both tried it. She came to the home. She does come to certain clients' homes. She'll do that if you're not able to make it to her location in Clinton. And also, perhaps soon we will be offering her services at Good Faith Wellness Center. We've been talking about it. I don't want to get ahead of you, Jasmine, but we have been talking about it. So you won't even have to go to, if you're in the Flowood area or somewhere that would be more convenient for you to be at Good Faith Wellness Center, you can certainly stop by. We'll let you know when that's finalized, when she's going to be there available. But it's coming soon. So wood therapy, manual cupping. Those are things that she does. We're going to couple that with Dr. North, a plastic surgeon, for December 10th. Now, she says, can sleeping habits, your posture and your positioning, produce a postural imbalance like scoliosis? Man, that is a fantastic question. Fantastic. All right. Sleeping habits and posture positioning, can it produce a postural imbalance like scoliosis? Now, the answer is, I would say this. If since childhood you are literally, kind of sleeping like this, so like, such a unnatural kind of thing like that, just so pronounced, right? Not just kind of with your hand outstretched, but you're really just kind of curving that neck in. Your body, if anybody has the dogs, if you notice how an animal sleeps, or especially dogs, they kind of curl up almost in a fetal-like position, like in a C, like in a ball. There are some people whose sleeping habits are so terrible that if you've been doing that with, you say, I have a crook in my neck every morning. I mean, if you're doing that from such a young age, yes, absolutely, I would think that could produce some posture issues, and possibly not necessarily saying it's going to cause scoliosis, but certainly it won't help it, and it can certainly probably exacerbate it, worsen it. So yes, sleeping habits and posture are very, very important. There are certain pillows. You've got contour pillows for the neck and head. You've got body pillows, and a lot of people like to sleep with those pillows, especially if there's nobody in the bed with you. The patients say they like a full body contour pillow, and that kind of, and you can put a part of it between your legs to help give you that natural spacing, so that your back and everything. It's the same way when you get a massage, they put that roll up under your legs. So that's also what the contouring pillows do. This is certainly not an ad for body contouring pillows, okay? But if there needs to be one, y'all can contact us at Good Faith Wellness Center, and we'll be glad to be a spokesman. But yeah, those are big fan of those things. Big proponent of body contouring pillows, but body contouring pillows and things like that, because it really helps support your body. You feel better in the morning, and it gives the correct spacing, to the vertebrae in the back, into the hips, and all that kind of stuff, so that you're not having that bad posture. And then let's see, we got one. Manifestation, she said, absolutely. So when we talked about the services we're going to provide in Flowwood, that's what we're talking about, manifestation. Most popular topic lately with my non-invasive bodywork clients. Okay, so you're saying that was that is your most popular topic with your non-invasive bodywork client. Yes, so we're talking about body sculpting and all that, because like I said, everybody wants to be the video vixen, the stars, and all that kind of stuff. So hey, and that's fine, because people have their reasons. We are a non-judgmental practice, and so we're going to help you achieve the best you that can be. She says high. So people with high hips, right? There's what people talk about, having things sitting up on your back and all that. So high riding hips may require pillows between the knees. And so again, that's kind of, and I appreciate you commenting on that. And so again, that's just like you say, if you bend your knees a little bit and sleep on your side, it's basically people that are waking up with some back pain and issues in the morning, try putting a pillow in between your knees. That gives that correct space on the hips, also helps your lumbar spine, your lower back, gives it, the proper spacing that it needs. And so everything can flow, fluid can flow, everything, lymphatic fluid, everything can go where it needs to go in the manner in which it was designed to go. All right, I think we got time for at least maybe 2 more questions or 2 more comments. So don't everybody go at once. The next 2 questions, let's do it. And again, we want to make sure you all know that, again, Mr. Kenoy Brown, we have been invited this evening to join him on his podcast, starting promptly at 8 o'clock. This is the Kenoy Brown Hot Topic Tuesday. And so we will most likely have him to help facilitate some special things on here. We've talked to him. He's just a great all-around guy, influencer here in Jackson, Mississippi, and he's certainly known outside of the city. And doing a lot of great things. He's a great person and a friend, and so we appreciate all that you're doing and things that you are doing to help this great community. And so we'll be, God willing, joining him in a few minutes at 8 p.m. Hot Topic Tuesday with Mr. Kinoy, Kinoy Brown. We just go there, go to his page on Facebook. We'll be there with you. And there's a few topics. You might say, well, what are y'all two doing? Because he's not a medical person and very, different. But he's got some questions on there people wanted to know about that are social questions. But that also, I think there were one or two that some people sent in to him that had to do with, people in certain careers and fields. And even when it came to what's healthy and what's not, and with the dating and all that stuff. So it ties in, some of those questions were tying into healthcare and healthcare providers and how you deal with certain things. So we're looking for that. Next two questions we will take care of here live. All right. One thing we wanted to bring out. So what about, we talked about, there was some things on immunizations. We did talk about that. Understanding the role of antibiotics and other treatments in winter illnesses. So that is a fantastic topic. One second. So the winter illnesses, we need to talk about antibiotics. And one of the things is that, okay, look, we all know, and we talk about this in medical school and also residency. Do patients, every time they feel sick or even have a fever, do they need antibiotics? The answer is absolutely not. But, in the real world, when you have a practice, and especially a private practice, that the doctor or the nurse practitioner or whoever the provider is funding themselves, this is privately owned. You're not owned by a hospital or some big corporation. So you're depending truly on patients doing well and patient satisfaction. Well, in that case, you want to make sure that there is some element of satisfaction and some patients are not going to be happy or satisfied until they leave with a Z-Pack, So absolutely, we want to make sure that people know that antibiotics definitely have a role when it comes to respiratory illnesses and during this season. But, that's something that it's really it's a personal kind of thing. It's up to that particular provider. But I will say that they have a role and they are overutilized. But again, people will come to you and say, hey, I'm paying my copay. I know what I need. I know when I'm sick. And so that's one of those things where you got to use your judgment and you want to do no harm, because we do take our oaths. But we do understand that there are some times when y'all come and you are not going to be happy if you don't leave without an antibiotic. So, let's see, I don't know if we have another one there. And then, one of the other topics here, we've got a lot of stuff on respiratory, a lot of things on flu and COVID. I think, just the thing is, one of the topics, and the last thing I'll talk about was, we got one now. Okay, I'll address that. What about staying healthy while traveling? That was another one. Staying healthy while traveling. Well, just like anything else, right? We're following all of the CDC guidelines. We're making sure to have primary prevention, taking the same measures. So the same thing when you're visiting Canada, you're visiting Europe, you're in Hawaii, you're in Kuwait, you're in North Korea, wherever you are, Morocco even. You want to still utilize the same common sense practices. You want to still go by the same CDC guidelines for prevention, preventing illness, for prevention of contracting respiratory illnesses like COVID, like the flu, bloodborne illnesses. So if you see somebody, bleeding, obviously don't touch it. And if you are a healthcare provider and you feel like somebody's either passed out or they've coded, they're not breathing, certainly you need to always protect yourself. And so if you are in another country and you see that and the authorities have not yet arrived, you certainly want to, put on some gloves at the very least and a mask. And so these are the same things that we do here. And so again, the question or the topic was, what are the tips for staying healthy while traveling? And again, they are the same tips, So being on a cramped airplane, a lot of times you'll have that one person that's continuing to cough in the back, and all the black folks turn around and say, wait a minute, you got that evil eye that you give them. So it's highly recommended, even though not required, that you have a mask on. And especially if that starts happening in a closed cabin or an enclosed space, you certainly have your mask handy that you can put it on. And please make sure final public service announcement, when you put on a mask, it is only doing what it's supposed to do if both your nose and mouth are covered. Hello. So you can't just only cover the mouth and have your nose sticking out, okay? Because you're still going to get all the disease thing, all the droplets or whatever it is, airborne, whether it's droplet spread or airborne spread, going right in the nose. The purpose of the mask and why it has a bridge on it that you can squeeze around the nose to make a little bit of a seal is because it's supposed to cover the nose. So we need to cover the nose and cover the mouth. So that's our last PSA. All right, last question. What topics are coming for November? Excellent. Let me go to my schedule. I've got that right here. I'm glad you asked. Let's see. So for our schedule, the month of November, we've got November 5th, we've got Dr. Ray Portis. Okay, he is an amazing pulmonologist. I've gotten to know him a lot over the years. Got a passion for the community. He's got a passion for a lot of things. He's an avid hunter. He's a fisherman. But most importantly, Dr. Ray Portis is a lung expert, a pulmonologist who is here to help you, help your family, and help make your lives better. So he's going to talk about what to expect in the ICU, right? In the intensive care unit in the hospital. So you don't want to miss that because we've had unfortunately, too much experience in dealings with COVID and being in the ICU. Also, November 12th, we've got Captain Christian Vance on community engagement. You'll be seeing a flyer or poster with this coming out very soon. So stay tuned for that. Captain Christian Vance on community engagement. We've got November 19th, cryo contouring, okay? And they're coming out of Nashville, Tennessee, all the way live to talk to us on Telehealth Tuesday. Cryo contouring and what exactly that is, and with body contouring. I know Jasmine Briscoe will probably be on there and help piggyback. So that's going to be on November 19th. And November 26th, Dr. Althea Kimball, who is going to be one of our next mental health experts, who's going to be talking about navigating the holidays. So again, you'll see a poster with this. Everything will be laid out, beautiful color pictures. And I know that you're going to know at least somebody on this photo person. You're going to know them. Please log on. Continue to support us. We thank you for everything that you've done, supporting us here at Telehealth Tuesday, which is here and occurring each and every Tuesday at 7 p.m. So with that said, we know we went 2 or 3 minutes over. We apologize for that. So we're going to slide on over to Mr. Kenoy Brown's show. Thank you for watching Telehealth Tuesday. And again, I'm Dr. Michael Bookhardt. And again, so next week, God willing, we will be there November 5th. Dr. Ray Portis will tell us what to expect in the ICU. And so we will see you then. Again, always on a Tuesday at 7 p.m. This is the place, where we treat and discuss all things, not just physical, but also for your mental and emotional health. And so with that said, we'll see you next week, Tuesday, 7 o'clock. And remember, true wealth begins with good health. Bye for now. Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health.